So expecting moms have heard staying healthy during their pregnancies is very, very important.
But there's a new study out that shows the effects of being overweight while pregnant are even more severe. This was a massive study. More than 1 million women studying this. Here with her take is our medical expert, Dr. Mandira Mehra from SSM Health. Good morning. Good to see you.
Good morning. Good to see you.
We're talking about in Sweden, more than 1 million women studied, and there's a connection apparently with women who are overweight or obese during pregnancy and birth defects. Very serious connection.
Of course, yes. And so we always talk about maintaining a healthy weight, just in general, pregnant or not pregnant. And then, of course, when trying to conceive or once you know you're pregnant, still maintaining a healthy weight. And I know this is hard for a lot of us to hear, especially while being pregnant. You're craving different foods and you think, well, the baby's craving this, so maybe I should eat this. But really, the recommendations are to only increase your calorie consumption by 300 calories a day. 300 calories means a cup of yogurt, maybe a granola bar, things like that. So it doesn't mean really indulging on the fried foods and kind of the cookies and Oreos and all those things that we think we're craving. So getting back to the study here, it did show that healthy women, of course, still can have some birth defects, but that number started to increase as the obesity number increased. So when we got to obesity levels 2 and 3, those congenital defects, unfortunately, also increased. So again, there's an association. We don't know exactly why, but there's a lot of theories. We know that increased weight in the mother does lead to increased complications, diabetes, heart conditions, and so forth. So maintaining a really healthy weight is so important.
Yeah, speaking of developments on the line of pregnancies and expecting moms here, there are some new methods in deliveries, one in particular called gentle or natural C-sections that have kind of developed. Can you kind of talk us through what this is and maybe why it's become growing in popularity?
Yeah. So the C-section, as you know, there's a couple different ways to, of course, deliver a baby. The traditional vaginal birth way is sort of the preferred method, not only medically, but also from a satisfaction level. Women always report that's a more satisfying way. You get to see your baby right away, get that skin-to-skin contact. Traditionally, in a C-section, which is a surgical procedure, it does involve an incision, usually emergent or medically necessary. It is a very sterile, cold, sometimes women describe it as almost a traumatizing experience, because traditionally you don't get to see your baby right away. There's a blue curtain between you and where the baby is born. So this natural C-section or the gentle C-section has kind of incorporated some of those vaginal birth delivery methods. For example, instead of having a sterile blue field, it's still a sterile field, but it's clear. And so you're able to see those first breaths that your baby takes. They also have tried to incorporate things like aromatherapy, playing gentle music, also letting the baby get that skin-to-skin contact as soon as possible to hopefully help with breastfeeding, bonding, things like that. So women that have gone through the natural C-section or the gentle C-section have described it as really a pleasant experience, all things considered. The important thing in the study here is that no one's trying to encourage more C-sections. They're saying if you do medically need a C-section or emergently need a C-section, here's just some things that we can do to make the parents and the baby's experience so much better. The nice thing is no complication rates so far have been higher. Medically, it's still safe, and they try to, of course, keep it sterile, and it's still a surgical procedure.
Absolutely.
Interesting topic.
Yeah.
All right, Dr. Mehra, good to see you.
Great to see you.
Thank you so much.
Thank you.